Hi, Joe Anderson. We're going to talk a little bit about saline irrigation. There are a lot of different ways to do it. You can mist, you can irrigate it thoroughly like the neti pot. We've got a handout that shows you several different ways, but the way that I prefer is the way I'm going to show you. And we can also do this with medications. We've put Budesonide, which is the steroid in Rhinocort, in the saline bottle for patients who have really severe problems, especially ones with sinusitis and nasal polyps. It's the only method that I've seen that actually shrinks nasal polyps. The other steroid nasal sprays don't do it. The advantage is there are no preservatives, nothing to irritate your nose. So either you're going to do it with just saline, you fill the bottle up to the line or just below it and put a little packet of the salt packet in it, or a half a teaspoon of salt with a pinch of baking soda, and shake it up, and that's a saline rinse. And then if we're adding medications, we'll explain to you how to do that. Now, if you look at this chart, you can see here that this is the nasal passage. These are the sinuses, okay? And this is going down the back of your throat. Now these sinuses drain through little pinhead-sized openings. So you're really not going to be irrigating the sinuses unless you've had sinus surgery. If you've had sinus surgery, you have windows and they're open. And if you do it with this method, it's actually possible to irrigate the sinuses also and not just the nose. Now the neti pot guy has you run it in the top nostril up and out the bottom nostril. I want to get it all the way up through the top and down the throat. So he has you use the top nostril. The important thing is we're going to use the bottom nostril. So you lean over, like you put your head to your knee, plug the top nostril. You're not spraying in the top nostril now. Put the bottle just inside your nose. It takes just a gentle squeeze but a pretty hard sniff. Now I can feel that running down my throat. So I know that I've irrigated all the way up and down my throat. And then I do the other side. Now you may have a little drip out, and that's okay. And that's all you need to do. You can do the whole thing again if you want. We usually have people do it a couple times a day or more. And then you don't have to mix up a new bottle every day. I tell people to mix up a new bottle once a week. So that's one salt packet a week. Saves you a lot of money. It also saves a lot of money if you're putting medications in there. Okay, now this is an addendum to the saline sinus rinse. If you haven't watched that, watch that little video first. Now for patients who've had really severe problems like chronic sinusitis and particularly nasal polyps, we're putting medication in here. And we have people put budesonide. It's gone generic, that's generic for Rhinocort. And you put ampules of budesonide in here. We usually have 3 ampules, and this is really quite cheap this way since it's gone generic. So you put in your salt packet and then 3 ampules of budesonide. And then you do the sinus rinse, just as I said before. You'll notice we use the bottom nostril, not the top. Again, the bottom nostril, not the top. You do what we tell you, and you follow the handout that we give you. Do not read anything that you get from the pharmacy or the mail order pharmacy.